Hook line, elbow, abduction, adduction. So we're going to start in the hook line position, feet flat on the ground, hip width apart, thinking about the ankle, knee, hip, and shoulder in alignment with each other. Arms start out at a 45-degree angle, palms up, so that we're encouraging a little flexion of the pelvis, a little thoracic extension in this position. So what she's going to do now is bring her knuckles to her temple, so her fingertips are touching the pad of her hands. She's going to bring her elbows together and give a little push, 1, 2, 3, out. Bring the elbows back to the ground, push into the ground, 1, 2, 3, back up. And so what we're doing in this position, when she comes back, you'll see a little bit more thoracic extension happening. And then we're repositioning the scapulas and getting a scapular glide. So we're really kind of working the muscles that attach to the scapula and getting the fibers to move, getting some microcirculation in the area into the joint, and repositioning that shoulder joint. If your therapist wants to do a little pelvic work, we can add the strap around the knees and put it just above the knee and go back to the hook line position, still maintaining having the hip width distance. She's going to engage out. Unless they recommend, you can let go and then engage out again. We're just going to keep a constant pressure out. And then when she does that, she can also tighten up her abs just a little bit for a little more core activation while she's still breathing. Or the therapist might recommend working and having a little pelvic stability through the adductors, in which case they're going to put a block between your knees. And you're going to engage in that block about 30% of your muscle strength while you still maintain the movement above. And so you're going to repeat as recommended by your therapist. And this is hook line, elbow, abduction, adduction with option of block or strap.